being better than the United States isn't good enough, Canada. It's just not. We have to aim for much higher, especially on things like healthcare, but not just healthcare. We should not be content with a system that is only positively shining when you look at the really, really bad elements of America's healthcare system. That should be our goal, to build a truly progressive system, a truly ambitious system, regardless of what the American system looks like. And for so many Canadians, I think they fall into that trap. I talked about this on David Dole's channel. The video just went up. After you watch this one, be sure to go watch that one. How Canadians tend to look to the United States and see how dysfunctional their system is and are just seemingly happy with the status quo here. And many American progressives look to Canada, and not unreasonably, and see the good stuff we have, and they sort of want to emulate us. But that slows them down too, because the reality is that they should be aiming for more than what Canada has, because our system isn't good enough either. You know, I noted this in my video covering Bernie Sanders' visit to Canada on the insulin caravan, where Bernie came to Canada and he talked about how insulin is, in some cases, 10 times cheaper here than it is down south. And he said, well, Canada has a better system. And it's true. Our system is better. But our Medicare system doesn't cover many, many necessities. Sure, our system is good because if you go to the hospital, you don't have to worry about getting a bill. Or if you need to go get a checkup, you don't need to worry about getting a bill. But our system doesn't cover eye care. It doesn't cover dental care. It doesn't cover your prescription medications. It leaves a lot out. It has huge gaps in mental health. Our system, in fact, doesn't cover a good chunk of what people need in healthcare. And ironic as it is, many of these things are preventative care or relatively cheap care that, because some people don't get, only ends up costing the system more. So for instance, that routine dental checkup and small cavity, filling will turn into a major infection if a person cannot afford the care they need. Or you go to the doctor with a minor health issue that can be fixed with a bit of medication, but you can't afford that medication, and so you get sicker. Or you're forced to cut your pills in half to try to ration them out. You skip a dose every second or third dose, which means the medicine isn't working as intended. But that's all you can do because you're too poor to afford medicine. And so here in Canada, we're one of the few systems with a national healthcare program, like a single payer program, a universal program, that doesn't include many of these things, like your teeth, like your pills, etc. And it's really a shame. And I think one of the reasons why Canadian governments, the center-right conservatives and the centrist liberals, get away with this is because Canadians will look to the United States and say, well, at least we're not those folks. Why worry about building something better when you look at the literal horror stories of the American system? And I don't want to downplay the differences. I don't want to suggest that our system isn't better and that there aren't things to be grateful for in Canada. But I do feel that we sort of lose track of context when we look at the United States and how bad their system is, and we don't see the potential for what we can build if we continued the work that had already been done. And we've sort of gotten complacent in Canada when it comes to building a comprehensive head-to-toe Medicare plan. And I think our Liberal Party has gotten away with it in part because they've been able to feed in on this Canadian complacency, which is rooted in a we're better than America philosophy. And so you're seeing Jagmeet Singh and the NDP, our Social Democratic Party, our party that's mostly aligned with Bernie Sanders, is a good comparison for my American viewers, is trying to push for a truly comprehensive plan, but will face pushback not only from the pharmaceutical and medical and insurance elite that doesn't want to support it, but from Canadian inertia, because they feel like our system's good enough, or they feel that we don't need a comprehensive pharmaceutical plan. Maybe we just need a patchwork plan to help those who need it most. But what we know is what you guys know, that Obamacare style plans, optional plans, are just a ruse to prevent truly universal coverage. And I think Canadians are in danger of falling for it when it comes to dental and pharmaceutical care because the American system is so bad, they're content with just being a little bit better. And I think, again, my American friends, you guys need to be better than us. Bernie Sanders' plan, if implemented, is not about catching up to Canada. It's about catching up to Canada and blowing right by us. Because Bernie Sanders understands the Canadian system is great. And there's value in showing Americans that the Canadian system demonstrates what's possible. The Canadian system treats people better and per person costs less. All of that is true. And all of that is valid. But Bernie came to Canada last year and he made it clear in saying, look, you guys have done a great job with your medical system, but you aren't done either. You guys don't have dental, and you don't have vision, and you don't have pharmaceuticals covered. And so you guys need to build your system to be more comprehensive as well. So the fight Bernie Sanders is having isn't like this fight that Canadians have already won. It's not true. Bernie Sanders is fighting for what Canadians have, but he's fighting for what Canadians don't have. And so American progressives who valorize Canada, I think, undercut your own message, and they don't really do favors for us up here in the North who want to do better than what we currently have. So I think we need to better communicate, progressives across the border, the challenges that we face, not just on healthcare, but I think healthcare is a particularly illustrative example. And I think healthcare is going to be a big part of our election here in Canada, with the NDP proposing a truly comprehensive healthcare plan, and in the United States with Medicare for all versus, Obamacare plus being a key debate within the Democrats. This is something we need to better communicate on. Because at the end of the day, progressives in Canada and the United States will win together, or will lose together. We need to build one another up. We can't abandon you guys by simply saying we're better than the United States, aka we don't need to push any harder. And you guys need to realize that we're not as great as we think we are. And as Canadians often talk about how great we are, we have a lot of issues too. And the issues have the same roots that your guys' do. 100%. We don't tax our rich enough. We don't have high enough capital gains taxes. We don't have high enough income taxes. We don't tax wealth in this country. We have the same issues you guys do. Insurance companies and the very wealthy prevent truly comprehensive Medicare for all. And so on both sides of the border, we need strong, progressive governments headed up by Bernie Sanders down south and Jagmeet Singh up north to push against the elite and to push for Medicare for all. Anything less will leave both sides behind. So guys, I hope you enjoyed this video. If you did, I would hope you like, comment, and subscribe. Also consider supporting me on Patreon. And be sure to go watch that video on David's channel. We talk about this, but we also have a broader discussion about what democratic socialism is and what it can be and what it can mean towards building a just society. So guys, hope you enjoyed this one, and I'll see you in the next video.